perspective would be that hospitals and healthcare providers in general are waking up to the understanding that understanding what a patient needs to have as a treatment is a different problem to actually ensuring that patient gets that treatment in the best way that they can. In the past, I would suggest that there's been a lot of focus, both in terms of investment and in terms of mind share of participants in this space around getting the best type of recording systems, the best patient administration systems, the best electronic medical record systems. I think it's now becoming clear that you can have the best system, but if the care that you need to be delivered isn't delivered in the right way, patients suffer and hospital operations suffer as a result. And it's that category, this mid-office category, that we think will be a clear way to help solve that problem. So at HG we've coined the phrase the mid-office, and we segment a hospital into 3 layers. The front office, which are systems and software and data that support the diagnosis of the disease that you have and what your care package might be. The back office being the finance and HR and operational systems that run the hospital as a unit. And where we're very interested at the moment is the emergence of what we call the mid-office. And this is a new category that we believe will become ever more prominent over the course of the next decade. And these are systems that allow a hospital to improve how care is actually delivered. So once a patient knows what sort of treatment they need to receive, it's data and software and services that enable that patient to be treated in the most effective way. So best use of the scarce resources in the healthcare economy. So from a healthcare system perspective, it enables patients to get better care at times that suit them best and at ultimately lower cost as well. So everyone wins in that scenario. From our perspective, we're looking to partner with businesses that are on a growth trajectory. We are investors in product and people, and businesses that have increased opportunity to sell their services into their customers are the type of customers we wish to back. Everything we invest in at HG is actually very well aligned to the long-term plan. So for example, the long-term plan makes specific reference to the benefits of increased use of electronic systems to support rostering of staff. That is exactly what Allocate does. There's a reference to the need for interoperability, for linking disparate software systems together. That is precisely the use case for Rhapsody as it's used in the NHS today. And there is also reference to systems that enable population health. That is exactly what our investment in Orion Healthier Population does. And then lastly, there's also a reference to the need to consider how you deliver healthcare outside of the expensive hospital environment, perhaps into the home environment. And whilst this company is not in the UK, that is exactly what our investment in Medifox in Germany is there. So we see our investment being very aligned to supporting governments deliver healthcare in a more effective and efficient way.